malls and everywhere else, it almost feels like there's no pandemic. So we may see more cases, we may see ongoing surges, which would force us to go into lockdown.
A health system on the verge of collapsing. There's calls for more help from the provincial government and worries that surging caseloads could lead to a lockdown. The school here looks to reopen weeks after an outbreak shut it down. We talked to a family still living with COVID-19. A live look outside tonight at a city blanketed in snow. It's going to continue for the next couple of hours, but should clear up tomorrow morning for the commute. Colette Kennedy with the specifics in her forecast tonight. I'm Chris Hensing. Thanks for joining as we start with breaking news tonight at the University of Windsor. The Vice President of Student Experience is leaving his role. The CBC's Tamina Aziz has been following this closely. Tamina, what more can you tell us about this?
Chris, the president of the university, Robert Gordon, sent out a letter to the school just hours ago announcing that Ryan Flanagan will be leaving his role as Associate Vice President of Student Experience. The role is supposed to offer programs and services that support campus involvement, leadership, development, community engagement, rights and responsibility, student event and activity support, transitional and first-year experience, volunteerism, and services learning, co-curricular mapping, and off-campus living. This announcement just comes a week after the university denounced Delta Chi fraternity for allegedly exchanging hateful messages that include racist and anti-Black comments. It also comes about a month after controversy. 2 professors said the N-word in classes. Now, CBC reached out to the university for further comment. This is what it said. Ryan has been a crucial member of our team for 4 years and has made a vital contribution to the University of Windsor. Ryan has been asked to leave his role in order to support the university's efforts to rebuild trust and make the meaningful changes necessary to be safer, more inclusive, and more equitable. We are focused on charting the path forward with our students, faculty, and staff for the wider Windsor community.
Now, Tamina, it says there he was asked to leave his role in order to support the university. How's the community reacting to this announcement?
Chris, I spoke to a member of RACES, a group of BIPOC staff and students advocating for equity, which asked for the termination of Ryan Flanagan as one of its list of demands to create a safer space at the university. She says she was relieved when she read the letter.
Ryan Flanagan is the person within the university who's in charge of ensuring that the University of Windsor has opportunities and that those opportunities are equal and equitable for all students, irrespective of racialization, irrespective of community and the way that that community might be marginalized before they come to the University of Windsor and while they're at the University of Windsor. He is absolutely charged with a big role, and he's been identified just over and over again as someone that worsens problems that exist as opposed to working to make them better. I believe that we as a university are moving in the right direction with this, and it's relieving to me as a woman of color, right, to see an institutional commitment made real.
The university encourages its students to use its counseling services as needed. Chris.
Thanks, Tamina. The CBC's Tamina Aziz live tonight. Now, that's a developing story. We'll have updates on our website as well, cbc.ca/Windsor. We take a look now at the spread of COVID-19 in Windsor, Essex. 62 more people have tested positive for the novel coronavirus today. A 90-year-old man living at a long-term care home has died. Now, as cases rise, the health unit today says that they're on the verge of collapsing. Katerina Georgieva joins us now live. How thinly stretched is the public health system?
Well, Chris, we're hearing a lot about fatigue. We're hearing that every resource is being employed. Everybody is working at full capacity and breaks are few and far in between. We're hearing that probably more restrictions are needed in the coming days, in the coming weeks to alleviate some of this stress, and that we're at a risk of heading into a lockdown.
A staggering 62 new cases of COVID-19 reported today. 18 active outbreaks, including 2 outbreaks in hospitals. Hotel Dieu Grace reporting 20 cases there in connection to the rehab unit, both staff and patients, and that's up from the 5 announced yesterday. Meanwhile, Regional Hospital has 4 among staff, all of this putting more pressure on an already burnt-out team.
We will be on the verge of, collapsing the public health capacity and also the acute care system capacity now that we have 2 outbreaks in the hospital system.
For now, we're in the red zone, and Ahmed would like to see if these restrictions will help control the spread. But if not, and the spike continues, a lockdown could be next.
The numbers are really going in that direction to force us into that situation.
The health unit says it's stretched thin. 40 nurses investigating 427 active cases, plus following about 1,000 additional contacts. In the meantime, they have been onboarding some new staff and leaning on the ministry for support, but it's still a heavy load. The health minister says the province will help the area get things under control.
We stand ready to assist the public officers of health and the medical officer of health in Windsor, Essex with whatever supplies they need in case they need more assistance with contact management.
But the opposition says that's not good enough.
To say that you're ready to help when we're in the second wave of a pandemic, they should have already been stepping up. They should have already been looking at what is needed in the various communities like ours and making those investments and ensuring that our health unit had the staffing that they needed in order to be able to do everything that they need to do.
Now, Katerina, we just got to this red zone, but we heard Dr. Ahmed say we're at risk of going into lockdown. What does it take to get there?
Well, Chris, there's no actual threshold to enter into a lockdown. No list of criteria the same way that we've seen in these other color stages. But we do know that the health unit is providing daily updates to the province in terms of what our cases are, where they're coming from, what sectors of the region they're coming from. But we know that there's going to be more discussion and consultation before a lockdown is actually called. Now, for more, I spoke with an infectious diseases specialist in Mississauga, which is a region that is currently in lockdown. And so I asked him if he thought that we are probably headed in that direction as well.
It all matters on numbers of different things, including the rate the numbers are climbing, where they're climbing, and the local healthcare capacity. So, when we in Peel, we got to a point where things were happening so quickly, there was so much strain on the hospital system, they had to do something more drastic. But that doesn't seem like the situation right now in Windsor, Essex.
He suggested that there are a number of interventions, of unique interventions that Windsor Essex could put in place before we have to go and take that drastic measure of going into a lockdown. But another doctor who I spoke with out in Toronto says that a lockdown is probably our only option right now because we don't have enough data about where exactly all of the cases are coming from. And he says it's probably the only option so that we can reduce the infections and make sure that we're not overburdening the system. And in the meantime, health officials are continuing to ask the community to do their part, to follow health regulations and safety regulations so that we can try and dodge a lockdown. Chris.
Thanks, Katerina. The CBC's Katerina Georgieva live tonight. The Windsor Mosque is closing its doors after someone who attended prayer last Friday tested positive for COVID-19. The Windsor Islamic Association says the person had no symptoms and is now isolating along with close contacts. The association says there was social distancing, face covering, and hand sanitizing at the mosque. Still, in the interest of protecting everyone, the mosque is closed until further notice. Officials say the building will undergo a thorough disinfection. Anyone who attended prayer at the mosque last Friday should watch for symptoms. The local health unit and school board are working on a way to safely reopen Bagley Elementary. Hundreds of students and staff were sent home after an outbreak was declared 2 weeks ago. At 49 cases, it's the largest school outbreak in Ontario. As Jacob Barker reports, getting people back in the building will take some time.
A lot of time no school this year.
This family lives just a few blocks from FW Begley, 5 kids at home, one who tested positive for coronavirus and is in his room in isolation.
He has COVID and he's gonna come back after Friday. I think he's gonna come. He's been a long time there, so I don't know if he's coming back or no. But he did a test. He had it. He coughs a lot and he sneezes.
He in his room. Just I didn't. Yeah, I help him. If he want to eat or anything, I help him.
And Is it scary to have your son with it?
لا خايف.
Yeah, I very scary.
Do you like the online learning?
No,
No?
no,
Why not?
because it's too hard
Okay.
to pay attention.
Why do you like being at school more? Sorry.
Because I can play with my friends and chat more and be there.
The school just a couple of blocks away is still quiet today, but now that 14 days have passed, it's been deep cleaned down to the windowsills and the whiteboards, ready for whenever the reopening happens.
We're feeling pretty confident that when kids come back, their environment is going to be safe.
According to provincial numbers, there have been 47 cases among students and staff, more than twice the number at any other school in the province. Now that 2 weeks have passed, the school board is in talks with the health unit to find a way to get students back in the door.
We do know that we want students back as soon as safely possible, and we know it's going to be a staggered approach. As to the date, it's not been established yet, but we're hoping for soon.
While the plans are still very preliminary, when it does come to reopening, it can say that there will be resources for mental health so that kids can get back to their routine safely. There are also lessons to be learned that will be passed on to others.
If we do get an outbreak declared after hours, are they ready to teach the next day? And so we learned that we do have to take our things home on a daily basis to make sure that we're prepared to teach. And for students as well.
At the end of the day, the school was closed by an order given by the health unit, so it will be up to it to decide when to reopen the doors. Jacob Barker, CBC News, Windsor.
An investigation is underway after photos show 2 Chatham-Kent EMS workers using an ambulance as a moving truck. The photo was posted this weekend. It shows a pool table being loaded into an ambulance. The company that manages Chatham-Kent EMS says they're looking into it but would not comment further. It posted a statement online saying, in part, quote, "We understand and share the disappointment expressed by those in our community and take these matters very seriously." Local officials are putting more pressure on the federal transport minister to save air traffic controllers at the Windsor airport.
Moving bodies out of a control tower causes issues for the future prosperity of Windsor Airport. It will cut this success story off at the knees.
Windsor Mayor Drew Dilkens was among a group who held a news conference at the airport this morning. They want Transport Minister Marc Garneau to intervene and convince NAV Canada to remove the Windsor Airport from a study. This will determine whether air traffic controllers are needed here.
So even if he says he technically can't take them off the list at this point in time, he can still go out and publicly say that he's actually against closing the towers and he's not going to approve them. He can do that any point in time. In fact, the process is if NAV Canada actually does eventually recommend closure or reduction of services, the minister then has to do another study. And the study then actually comes back again. So we're into this cycle of study after study after study when it is completely unnecessary.
Pilots say removing air traffic control from the airport is too dangerous because of the high volume of air traffic from Detroit. Brian Massia plans to put a petition up on his Facebook page and website tomorrow for residents to sign. The petition calls on the government to keep the controllers at the airports. With potentially multiple vaccines just around the corner, Justin Trudeau was asked today, who decides who gets the doses first?
The priority is to get it out to the most vulnerable Canadians quickly. But we have a panel of top experts and scientists looking in directly to these challenging ethical and societal questions of who gets the vaccine's access first. We should all agree across the country on what that list looks like and make sure that it is applied fairly right across the country.
Now, the Prime Minister says it won't be politicians, but experts who decide how it's distributed. Health Canada is currently reviewing 4 vaccine candidates for safety and effectiveness. Now, refuting that idea that Canada is at the back of a long line of other nations, Trudeau says we have been guaranteed some of Moderna's first batch once its vaccines are approved here. I spoke with Canada's Procurement Minister, Anita Anand, earlier today. I think the question on most people's minds today, when will people in a place like Windsor and Essex County have access to a vaccine?
Well, it is a fantastic question, and let me assure you that I, like many people across this country, are eagerly waiting for a vaccine. The most important thing we have to do, though, before we distribute a vaccine is to make sure that vaccine is safe and effective. And when Health Canada approves a vaccine for Canadians, then we will begin the rollout of that vaccine. Having said that, we are putting in place the logistics as we are expecting a vaccine to be rolled out in the first quarter of 2021. We have purchased refrigerators, for example, to ensure that we can store and transport doses of vaccines in the amount of 33.5 million vaccines. In addition, we are purchasing syringes and gauze and needles and swabs so that when the vaccine is being distributed to provinces, they can then administer the vaccine.
When we look at what's going to happen here in Windsor, Essex, just across the river in Michigan, there's counties that expect to have their first shipment of the vaccine by the end of December. Can you explain why Canadians may have to wait while our neighbors in Michigan are able to get a vaccine?
Well, I think what Canadians really expect from our government is that we would not roll out a vaccine to anyone unless it was safe and effective. The Canadian health regulator, Health Canada, is considered to be one of the strongest in the world. Indeed, some refer to it as the gold standard of regulators. And so what we want to make sure as a government, first and foremost, is that the vaccine is safe and effective. And then we will roll it out to Canadians. So I would encourage us all to make sure that this has occurred before we then move to distribute and take that vaccine.
You mentioned making sure that it's safe and that people are open to taking the vaccine. What have those conversations been like, making sure that people feel as if this is the right thing to do?
Well, that's a great question because we do have to make sure that people feel comfortable with taking this vaccine. And the way I think that we ensure that level of comfort in the public is to elucidate the fact that Health Canada will undertake its regulatory and review process, considering all the data without political interference. And that is a process that I think we should all take comfort in, that we do have a regulator that acts with integrity. And after that occurs, my Department of Public Services and Procurement Canada will work with the Public Health Agency of Canada and the provinces and territories to make sure this vaccine is distributed across the country.
A look outside at the first real blast of snow here in Windsor, Essex. Looked pretty, felt cold, but gave us something else to talk about. Could stick around, but first, take a look at this here. This is something you might have noticed popping around Windsor, the Bright Lights Festival, moving to a COVID-safe format this year. Instead of being centered around Jackson Park, as the display has been in the past, it's popping out throughout the city at different locations. Those lights are going to keep shining until January 10th. We'll be right back. First day of December, and we're back to this. This is what most of us woke up to this morning, some very wintry weather, the first significant snowfall of the year, messy conditions on the roads, enough to cancel some school buses here in Windsor, Essex. Most school buses in Chatham, Kent, also canceled. But as we bring in Colette Kennedy, the snow day is a little bit different. Now everybody can work from home, so you kind of just got to power through it.
Yeah, it's kind of a bummer for the kids, isn't it? But I guess they're home, they get go play in it a little bit, and it was that nice wet snow, right? That was good for packing and making snowballs and snowmen as well. But yeah, everything is so different. Well, it is the first day of December. It's also the first day of meteorological winter, so that begins on the 1st of December as well. And here we are with the wintry conditions. The range in terms of the amounts, I've seen 5 to about 10 centimeters, and much of the higher amounts are a little bit further east. And in fact, you don't have to go too far further east. You get to London, where they're now approaching around 20 centimeters. Again, a few areas locally where there's a little more or a little less, but that's what they're reporting for now. And then it just gets a little crazier as we get further out. But I'll get to that in just a moment. These are our temperatures just to show you what's happening here in eastern Ontario. It's still a rain event because the temperatures are above freezing there in the nation's capital, up around 4 and 5 degrees. But look at the rotation. You can see this. I mean, it's illustrated so nicely. There's the area of low pressure, counterclockwise rotation around it, and now we're kind of into a situation where we're getting the bands, and then we get a break and then another band. But it is going to start sliding off towards the east and moving away finally, but that's not really going to be happening till we get overnight tonight, and so that's when we'll start to get into a clearing trend. So yes, the special weather statement has been dropped for the Windsor area, but winter storm warning, that's what I wanted to get to. These are additional amounts that I put on here. So an additional 10 to 15 centimeters in northern Grey County. But there I have seen reports for the Blue Mountains around 45 centimeters of snow, at least in one case. So that's where it's been really significant. Also just over towards Barrie, around 15, Midland around 20 centimeters. But again, I've got your additional amounts in here. So London, actually, it's probably going to be on the lesser side of that. So towards the 5 and not so much towards the 10 as things start to wind down. What's not winding down, though, the winds. So those winds continue to be gusty. So there's still going to be some lake enhancement. Because of that, through the London area, maybe a little extra cloud cover hanging in there and some flurries hanging in there. But otherwise, look at how we're going to be clearing out later on overnight tonight into tomorrow morning and bringing back actually sunshine coming in. So there will be some melting in here, even though the temperature's not going to be that warm. And in fact, the winds, there's a significant wind chill for tomorrow morning. Now, Thursday, another kind of system backing through. The cloud cover, I know on this model, it wants to stay well to the east of us, but I think we may get a little more coming into our skies. So I've actually put that into the forecast. We'll be watching how that shifts. Snowfall potential additional. Not too bad on top of what's already fallen, and that's what's still to come. There are those wind chills for tomorrow morning, so be aware of that, even though the temperature's only at -1, because we do have those winds pretty gusty that are going to be coming through still, gusting 50, 60 kilometers an hour. They back off a tiny bit through the overnight, but then kind of pick up again through the morning, and then this is what we're looking at towards tomorrow afternoon. But that sunshine is going to feel pretty good, I would expect, and that 4 degrees. Thursday, it's going to depend on the cloud thickness here, but I've got us up to 5 degrees, and then you kind of see the trend 3s and 4s from there in terms of daytime highs, but not extremely cold overnight, which is also important, Chris.
No, and it's nice to see the sun out there too. Thanks, Ms. Colette.
You're welcome.
Now, plenty more coming up after the break. Some breaking news that just came into our newsroom. All the hospitals in Windsor, Essex are having a big change to their visitor policies. Based on rapidly rising case rates for COVID-19 and the active outbreaks at two campuses, Windsor Regional Hospital and Hotel de Grace Healthcare, all three hospitals, so that includes Erie Shores Healthcare, are reinstituting a no visitor policy at all of their locations effective 12:01 a.m. Wednesday, December 2nd, 2020, so at midnight tonight. They go on to say that this difficult decision is intended as a precaution to keep patients, families, and our healthcare teams safe as transmission rates rise and risk a crisis point for hospitals. High patient volumes throughout our system and reduced bed capacity is challenging the entire regional healthcare system, and they must do what they can to limit the opportunity for further spread of the COVID-19 virus. Again, that's all three hospitals, Hotel de Grace, that's Windsor Regional Hospital's campuses, and Erie St. Clair, saying that they are putting in a no visitor policy. There are limited exceptions, but you have to go through the hospital to figure out what those will be and if it will be for you or your family members. Again, this is on a day as we report 62 new cases of COVID-19, a man in his 90s dying after testing positive for COVID who lived at a long-term care home in our area. That's 80 people who have died since this pandemic has started in Windsor, Essex alone. For more on these stories, you can go to cbc.ca/Windsor. We're on social media too. You can check us out on Facebook, Instagram, and Twitter. Thanks for watching. Have a good night.